Hi everyone, so for our health promotion project topic, we decided to choose substance use. So in today's presentation, we'll be diving deeper into the idea of substance use and how it applies to the chronically ill patient, as well as the geriatric population. With that being said, let's dive deeper and talk about what substance abuse is within this population. So, substance abuse in the chronically ill and geriatric population is a significant but often overlooked issue. In this case, older adults and those with chronic conditions face unique risks, such as misuse of prescription medications due to their pain, their mental health issues, or complex drug regimens. Aging, polypharmacy, and social isolation can increase vulnerability to misuse, while chronic illness may lead to dependency on medications. Effective management requires a multidisciplinary approach to prevent and detect, as well as treat substance abuse. And this is to aim to improve health outcomes and the quality of life for these individuals. Just to get a better idea of how substance use affects our population and everyone's daily lives, here are some fun facts to consider. Nearly 108,000 Americans died from drug overdose in 2022, and excessive drinking attributes to about 500 deaths per day.
We split the drugs we're focusing on into two different categories, opioids and stimulants. The manifestations of opioid use include pupillary constriction, drowsiness, sedation, respiratory depression, nausea and vomiting, constipation, slurred speech, bradycardia, hypotension, and itching or flushed skin. For stimulants, the manifestations include dilated pupils, tachycardia, hypertension, increased energy, decreased appetite, dry mouth, sweating, tremors, teeth grinding, and insomnia.
Manifestations of alcohol abuse withdrawal include tremulousness, anxiety, insomnia, tachycardia, diaphoresis, anorexia, agitation, headache, and GI distress. The clinical institution withdrawal assessment alcohol, which is also known as CWA-A, is a scale that measures the severity of alcohol withdrawal by assessing the 10 most common symptoms. Complications of substance use. First, we have hepatotoxic injury. Some drugs are known to have a toxic effect on the liver depending on their chemical structure and the way they are metabolized in the liver. Next, we have seizures. Seizures may occur during all serious illnesses or injuries affecting the brain, including substance abuse. And next, we have chronic insomnia disorder. Some drugs commonly related to insomnia are caffeine, nicotine, stimulating antidepressants, alcohol, and recreational drugs.
When taking care of someone that's chronically ill or an older adult that's impacted by substance use, there are some additional considerations for their care. The first being age-related changes to their body, so reduced liver and kidney function that can cause slower metabolism of different substances, which we know can increase the risk of adverse effects and cause toxicity. In those that are chronically ill, their conditions can be exacerbated by substance use. The example I just used here was how alcohol can increase blood pressure and make the hypertension worse because of its vasoconstrictive effects. A lot of older adults are often prescribed a lot of medications to manage their chronic conditions. This can increase the risk of drug interactions or diminish the effectiveness of their prescribed medication that they actually need, especially when alcohol and drugs are in the mix. A lot of people that experience chronic pain can be impacted by prescription misuse. A lot of times this is with opioids or benzodiazepines. For isolation and mental health, we know that a lot of older adults experience isolation and loneliness, and then this can also cause them to have depression, anxiety, or other mental health issues. And so a lot of times substances are used as a coping mechanism. And then we also know that when people are under the influence of drugs or alcohol, they have impaired balance or coordination and can lead to more falls and injury. And in our older adult populations, those can lead to fractures or other bigger medical issues. And then barriers to treatment, we have access issues. So a lot of older and chronically ill people can't mobilize like other people. They might not have transportation access. Caregiver strains, so people that are taking care of them might experience burnout or provide lower quality care just because of the stress associated with substance use. And then lastly, healthcare costs. So the complications related to substance use can cause people to either have longer or more frequent hospital stays. It's also important to note how big of an issue this is on a national and local scale. Across America, nearly 1 in every 5 adults age 65 and older are affected by alcohol and drug abuse. And this affects our local community because substance abuse is heavily connected to violence, crime, housing problems, injury, and financial distress. In Washoe County, both alcohol and drug-induced deaths were greater than the U.S. and Nevada in most older adult age groups as of 2017. As of 2022, 9.5% of Nevadans were affected by drug use disorder and 6.2% by alcohol use disorder, which is well over the national average in both categories.
Addressing substance abuse in the United States through preventative care can take several forms. Providing access to education and awareness campaigns, access to resource centers and clinics, and searching for community engagement are all examples of what can be done to prevent substance abuse. In the state of Nevada, the Substance Abuse Prevention and Treatment Agency, or SAMHSA, is responsible for funding and providing these various prevention strategies for substance abuse. The Center for the Application of Substance Abuse Technologies, or CASET, has also provided certified and funded programs for substance abuse in the state of Nevada. Join Together Northern Nevada is the prevention coalition that was established for Washoe County. Their website provides immense information surrounding preventative care for substance abuse.
Our project emphasizes the importance of individualized care in treating substance abuse for different situations, including population considerations and barriers to care. Safety is always at the core for substance abuse treatment plans. This entails creating a safe and non-judgmental environment that addresses immediate physical and psychological needs. We should also collaborate with our patients on the plan of care and determine whether outpatient or inpatient treatment is appropriate. During the detox process, careful assessments should be performed and the appropriate medications should be administered. To monitor symptoms, the Clinical Opiate Withdrawal Scale for opioids or the Clinical Institute Withdrawal Assessment for alcohol may be used. These scales determine medication doses. Benzodiazepines are used for alcohol withdrawal to prevent seizures and manage anxiety. Methadone eases the process of opiate withdrawal, and bupropion can reduce nicotine or stimulate cravings. Additional medications may be used. Relapse prevention strategies are another important aspect of care. Continued support systems should be in place. This could be family, friends, a sponsor, or groups such as Alcoholics Anonymous or Narcotics Anonymous. We should also promote overall well-being and address any comorbidities or underlying conditions, such as those pertaining to mental health.
So there are a couple ways that we can target diverse populations in order to educate them on substance abuse within the geriatric population. So for one, we can use multilingual educational materials. These look like translation services, which are used to develop educational materials in languages commonly spoken in Nevada, such as Spanish and Tagalog, as well as resources for rural communities. We can also use culturally relevant content. This ensures that the information reflects cultural contexts and considerations unique to Nevada, such as the prevalence of tourism and its impact on substance use. And then finally, we can use NIH resources or the National Institute of Health. Utilizing NIH's resources for health communication will help us include translation of health information, basically. So they have a National Library of Medicine, which provides health information for a variety of languages and cultures. And then another way that we can target diverse populations is through community outreach and workshops. So this looks like teaming up with local businesses, senior centers, and health clinics in Nevada, such as the Nevada Department of Health and Human Services, to host seminars on substance use. We can also have bilingual presenters. This will help engage bilingual healthcare professionals or community leaders to present information and answer questions in participants' preferred language. And then we can also organize sensory-friendly events. So this looks like organizing workshops that accommodate individuals with sensory sensitivities, such as quieter environments and visual support.
Risk reduction. Our project assists in risk reduction related to substance abuse by education and awareness. Educating individuals about the dangers of substance abuse, its signs, and long-term effects can help prevent initial use and encourage those struggling to seek help. Then we have early intervention. Identifying and addressing substance abuse issues can prevent more severe consequences. Then we have access to resources. Providing easy access to resources can help those struggling with substance abuse find the help that they need. Then we have reducing stigma. Working to reduce the stigma associated with substance abuse can encourage more individuals to seek help without fear of judgment. And lastly, we have technology and innovation. Utilizing technologies such as apps for monitoring substance use, online support groups, or virtual counseling can increase accessibility and engagement in prevention and treatment programs.
Technology and information dissemination. Ways to spread information. We can have printouts and handouts available to patients, like the one you see to the right, so that they have a physical copy of their resources. We could have these printed out in different languages and maybe even see if we can print them out in Braille to reach a wider audience. We could also encourage patients to attend in-person or online workshops and conferences if they want additional information or support. And finally, we can utilize social media and other online platforms to spread information. Your specific facility can have a substance abuse resources page that people are able to access. And finally, we want to recognize that there might be those who do not have access to the internet or a mobile device. So as nurses, we can connect them with a library or other community center to get them those resources. Let's tackle substance abuse together. Addiction and chemical dependence can be hard to overcome. However, as nurses, it is our job to continue to educate and provide resources to all our clients to promote a substance-free future for all. Thank you.